Timor-Leste is experiencing a staggering spike in suicides, recording 6 deaths in the last 3 months, almost half of the 16 cases reported last year. This mental health crisis is met with a critical shortage of resources, as the entire nation currently relies on just 3 resident psychiatrists. The alarming trend has prompted medical professionals to issue an urgent plea to the Ministry of Health and mental health advocates to immediately expand basic services and intensify public awareness to prevent further loss of life.
Abelinda acts as a steady anchor, waiting for the man she loves to resurface. Her husband was first diagnosed with schizophrenia, a chronic mental health disorder, last December.
We came here because he was very aggressive. He destroyed things, he cursed people, and he didn't recognize us, his family.
21-year-old Abelinda told RTTL that this is the second time her family has left their Atauru Island home to be closer to the National Hospital, as her husband Fernando requires intensive treatment.
I brought my husband here to get him treated early so he can recover to be with me and our daughter.
Abelinda said his illness resurfaced after he stopped taking his prescribed medication for 2 weeks.
His medication ran out at home and we forgot to pick up more from the health center.
After 5 days of treatment, he is feeling better and is able to communicate with her.
After getting treatment, his condition is a bit stable, and he recognizes me as his wife, and he asked for our daughter.
Currently, there are more than 1,000 mental health patients requiring regular treatment and intensive care at the National Hospital Acute Care Unit. Across the country, there are only 2 acute care units for mental health disorders, one in Dili and one in the highlands east of Dili. 4 patients are currently undergoing intensive treatment at the National Hospital.
We have space in this center. We have 14 beds and right now only 4 patients.
Despite the empty beds, many patients are not receiving the required treatment, as access to support and information remain a challenge.
My concern is the public is unaware of the mental health illness and services. People who have mental health problems should be treated early on, rather than waiting until aggressive behavior appears.
A recent survey conducted in schools reveals high prevalence of suicidal thoughts among children. Last month, a report from Timor-Leste's National Police confirmed most suicidal deaths involved young people.
The message for parents is to build strong relationships with their children. If there are problems, communicate with them properly. Help them find solutions, and don't let them face their struggles alone.
With only 3 psychiatrists available, Dr. Kintown says health workers across the country have been trained to provide basic care for people with mental disorders.
We've trained health workers in all municipalities. So now in every health center, we have a health worker who is responsible for providing care for people with mental health illness.
If you or someone you know requires mental health support, you can call the mental health hotline on 333-1247. Paulina Kintown, Flavio Barros, RTTL World News.